What we're going to do is do a demonstration of using a myTAP device. The advantage of a myTAP device, it can be used in several clinical applications. One in particular pertains to when patients are in doubt whether oral appliance therapy, specifically a custom device, would assist them or would facilitate their symptoms. So one way to kind of mitigate that is to fabricate a trial device that they can actually go home with, wear it for a period of time, and as a result of wearing it, determine the outcomes and the benefits they may receive as well as their bed partner. Furthermore, you could even test them with this device to see if they were effective with the utilization of a trial device before you committed them to a custom device. Another application could be a scenario where a patient has a custom device that the device is fractured or needs to be repaired and sent back to the laboratory. This may be an instance where you fabricate a temporary trial device that the patient can go home with while the device is being repaired. So the first part to this device is you have an upper and lower tray that is connected together with an adjusting rod. And on the rod you have basically a screw that allows you to drive the lower jaw forward. So the first thing we're going to actually do is dismantle the device and separate them out into two pieces. All right, and we're going to slide the top portion away from the bottom. What differentiates one from the other, the top portion has this beak and the lower portion actually has the shaft. And as you can see, this shaft is very adjustable as well as movable. These custom devices are very adjustable where they can fit a different arch type, such as a small, medium, or wide. The way you would set that is when you assess this in the patient's mouth, you want to make sure that their device itself will cover the teeth. If you find that it's too constricted, you can put in some warm water and expand it. Or on the other hand, if you think it's too wide, you can put it back in warm water and contract it so it fits the arch. So what we're going to do right now is just to see if this is the appropriate size for our model. So what we're going to do is take a look at the device, and we're just going to passively align it over her upper teeth. What you're going to notice here is when I set this in, I actually will take this beak and use the tip of her nose as a point of reference. The idea for that is when we actually get this device in mouth and get it molded to her teeth, we actually line it up with the nose so that when we do the lower arch, we have the same point of reference. So let's go ahead and close on into that for a second. And what we're going to take a peek at is to make sure, which it does, covers all the teeth adequately. So our next step would be to go ahead and get some warm water, and we are going to actually place it in the water and have it soften up. And what you'll know that will occur, when you know this will occur, is when the white material will turn to a clear. The hotter the water, the better the outcome. And as you can see, it's starting to change color. Okay. So how you know it's ready, you'll see that the material has changed from a white to actually clear. So it's time for us to set this in the patient's mouth and get it molded to fit her upper teeth. So you gotta be a little careful here because the softening will actually allow the side walls to be a little bit more softer where it's easy for you to bend over. And what you're gonna just do is gently have the patient open, retract the cheek, and align it to fit the upper teeth as described earlier when we did the trial with the appliance. As you can see, the beak is centered with the nose, and now we're going to have the patient passively bite into it so she can keep it and brace it in place. The next set of instructions will be for her to pucker up her cheeks nice and tight, and we would do this for probably 10 or 15 seconds, and then to also take a tongue and thrust it up against the roof of her mouth to have it mold on the underside of the upper arch. Okay, and we'll just let it sit and we'll let it set up. In about a minute, I'll actually go back in and run my fingers, stay close to me, I'll run my fingers on the buccal aspect just to get it to adapt to the teeth a little bit better. So as this is setting up, you can go ahead and get ready by getting the lower tray prepped where you'll actually immerse it in warm water. So what I'm just going to do here is walk up along the buccal wall, just bite into that, and I'm just going to push up against it so it adapts to the teeth, allowing better retention. If after adapting it and you've allowed the tray to cool, if you find you have poor retention, then just place it back in warm water and remold it. The advantage with this material, it returns to its original shape, so you can remold it multiple times without having to use a new device. So what you want to do is intermittently you want to take a look at this, and you want to make sure that the color from clear is now converts itself towards white, as you can see. So it's time for us to gently remove the upper component. Go ahead and open for me. And what you'll find is once removing it, you'll let it sit on the bench for it to then completely set up. Now in the office, a better way to speed this process up is if you have an air water syringe tip. By having air blown over it, you'll get it chilled quicker. Therefore, the patient does not have to keep this in the mouth for a long, extended period of time. Or you can give them a cup of some cold water that they can hold in the mouth to just speed up this process. Okay? So what we're going to do now is just set the upper tray in this carrying case and take the lower tray, and we're going to go ahead and get it ready to be molded in the lower. The first thing, as always, you want to just try the tray in to make sure that you have an understanding whether you have to modify it to allow a little bit better width or contract it to reduce the width on the tray. So before we put in the warm water, we are just going to go ahead and place it over the lower teeth. And once again, the point of reference is the nose. So go ahead and close down for me. What you'll see is you keep the shaft aligned with the nose as we did with the beak. So when we put the two components together, we won't have the lower jaw being pulled to one side excessively more than the other and be very much in close proximity. There's a little bit of a buffer built in that if you're slightly off, there's a little bit of flexibility in this rod to make up that difference. So the first thing, stay close to me, dear, thank you, is once again, you want to just make sure that the tray covers the teeth, as you can see here. So our next step, go ahead and open, is to go ahead and place this in some warm water and get it to return to that clear state as demonstrated previously. So as you can see, you've now taken a tray that looked white at a period of time. After soaking in some warm water, it goes to this clear state, which is time for you to insert it in the patient's mouth. Now with this lower tray, one of the note of caution is the tongue. So one way to prevent unnecessary bending or voiding of the lingual aspect of the myTAP is to have the patient raise their tongue up while you seat the device in place. So I want you to raise your chin up, open big for me first. Okay, now raise your tongue up. Oh, there you go. There you go. Keep the tongue up. And you want to once again make sure this is aligned with the nose and then have them go ahead and bite down into that. And the same thing, you want the patient to pucker up against it and take their tongue and just push up against the tongue side of that lower tray. And we'll do that for about 10-15 seconds. We'll let the tray stay in place. In about a minute, we'll go back in and finger mold the sides to make sure it adapts better to the teeth. So about a minute in, you want to take a look at this tray just to make sure that you can start seeing that it starts changing towards that whiter tone. And you just want to go ahead and with some passive pressure, just want to kind of adapt the tray so it molds into the buccal walls both on the right and left side for better adaptation and retention. And there again, as pointed out earlier, if retention is poor, you basically just repeat this step by placing it back in some warm water and refitting and remolding it. So you want to check, and what you're looking for is to see the return of that white color as opposed to clear, suggesting that it's pretty much set. Go ahead and open it for me. And we are going to passively just remove it and then let it finally set outside the mouth. So a few tips and a few concerns. When this material is softened and when you take the lower tray into the mouth, as pointed out earlier, you want to make sure that the patient lifts their tongue up. The reason for that is this lingual wall right here. If they don't lift their tongue up and you set this device in, there's a tendency of this lip or flange to roll over. Now if that were to happen, this being a thermocryl material, if you place this back in warm water, you can actually tease it back and then reset it back in the patient's mouth. The other note of concern is retention. The device does get tighter as this material cures. The curing can take up to 24 hours. If the patient experiences tightness, soreness the next morning, bring them back into the office, set this back in lukewarm water, partly soften it, take it back into the patient's mouth, and what you'll do is you'll seat it, remove it, seat it, remove it several times, and then let it bench cure. And what you'll try and do there is just to give them enough of a gap so there's not as much friction up against their teeth. So now that we have the upper and lower trays, we're going to go ahead and assemble it. To assemble it, you'll basically take the flat surfaces and approximate them. You'll take the lower advancement shaft into the upper beak, and then you go ahead and add the little screw that allows the advancement to take place. So the key is just to get the screw on there and not to completely dial it into place. We're going to determine exactly where to dial it once we've put this apparatus back in the patient's mouth. So we're going to go ahead and collectively re-engage this device into Tricia's mouth. All right, go ahead and close down into that and bite down into it. So what you can get a sense of is with the two components together, you've got your point of reference where the lower tray, upper tray meets, where it doesn't seem to pull the jaw in one direction or the other. If you do not use the nose as a point of reference, what you might find happen is when you assemble the device and they engage the lower teeth, there'll be a tendency of the lower jaw being pulled in one specific direction. Now, if you run into that problem, just remove the tray that's affected, whether it be the upper tray or the lower tray, place it back in warm water, remold it by aligning it with your point of reference, and then reassemble the device. Now, to determine how much to protrude our patient, what you're going to see here is I'm going to have the patient jet their lower jaw forward. And you can kind of get a sense of how much range she has. So this is maximum protrusion, and go ahead and slide it back. And this is kind of where we set the screw initially to kind of assemble the apparatus. Most of the time, go ahead and slide your lower jaw forward. What I would do is go ahead and slide all the way forward. I would basically dial the screw to about midway off her range. So this is roughly about 50% or so of her protrusion. To dial the screw in, it's a clockwise turn. And go ahead and let it slide back again. And this is approximately taking a lower jaw about 50% of her entire range. The other point of note here is the patient themselves can adjust this device if they're still having symptoms, whether that be snoring, fatigue, whatever may have led them to come to the office to have a trial device fitted. The advantage with this is a bed partner could also assist in the titration process. This merely means that when the patient is sleeping in the bed partner can actually reach over and do 1 or 2 dials per day in an effort to assist with adjusting the device based on noise, specifically snoring. The note of caution here is to allow the patient to titrate this device till they are tolerable or there's resolution in their symptoms. To remove the device, if retention is very tight, have your patients take their fingers and go up on the lower tray and slide as far back as you can. As they lift up with their fingers, I want them to open their lower jaw. So they're using their lower jaw as a fulcrum to disengage from the upper component. To remove the upper tray, if retention is very significant, is to take your fingers as far back as you can on the upper and push one side down completely. And by doing so, the opposite side will automatically disengage. What you may find at times, if the patient actually tries and pull on both sides, because of the curvature of the teeth, it's very difficult for them to disengage from this device. And as a result, you may get patients that may panic. To take care of this device, since warm water, hot water was utilized to mold it, the patient's instructions are basically brush it with a plain old brush. Since this device will be in the mouth for 8 hours or so, it's going to have plaque that will form just as plaque will form on teeth. So brushing the device on a daily basis is important. Do remember, this is a trial device. The idea here is to use the device to see if it's going to be of any benefit for the patient to consider custom oral appliance therapy, and therefore the intention is not for long-term use. It's been recommended that this device be used up to 4 to 6 weeks, with a few exceptions. So once you have this device and the patient has gone home with it, and the patient has actually dialed it and titrated the device to a point that's actually therapeutic, up to this point, the decision of whether the device is working is based on subjective. Bed partner's comments, maybe how the patient feels, and things of that sort. The next most important step is to objectively measure it. Objectively meaning some form of testing, whether it be a home sleep test or an in-lab test. The testing will then validate whether the original index that they may have had that they were diagnosed with has significantly improved. What this also does, it gives us the ability to decide if the device is going to be therapeutic for them, but also in a nutshell, you will know roughly where the jaw needs to be positioned to get effective results. So in a way, you also have your final bite position as a result of using a trial device. And then you also have this morning aligner. What you have to understand is when these patients wear these devices, which brings the lower jaw forward, there's a tendency the next morning that they'll notice a slight bite change. What this AM aligner allows us to do is allows us to get their bite back. So first we need to kind of mold this to fit our patient's bite. And the way we're going to do that is take the wafer out of the bag and place it once again in some nice hot water. Just be careful if you immerse your fingers that you take that into consideration because it is very hot water. Once you see it soften up, what you're basically going to do is take this to your patient's mouth, have them open, and the intention is to go ahead and get a centric occlusion bite. So you're not protruding the jaw, you're just placing it over the teeth and having them just bite down to the natural bite. As they bite down, I want you to have the patient take their tongue and push up against the material on the inside, upper arch, and then with your fingers, I just need you to passively and gently just mold it up against the teeth. And then just leave it in place until it gets a little bit firm, and then remove it and run it under some cold water. One of the key instructions with this AM aligner, especially from the patient standpoint, is the only way to really take care of it is to brush your plain old cold water. Never to soak it in warm water, since warm water will distort it. What this will do is give the patient the ability to establish a new bite in the morning once they remove their myTAP device during sleep. The way you would wear this device, you'll basically put it in the mouth, take the lower jaw up into the grooves of the AM aligner, and bite into it for approximately 20 seconds. And repeat that 3 times. And what they will find that after the 3rd attempt, after removing the AM aligner, their bite will be back. So to check that if it's time, I want you to go and just push up against it, and if you can't indent it, then it's time for you to remove the device. Go ahead and open that for me. And what you'll see will happen here is you'll get a good indentations of your patient's dentition, the upper arch and the lower arch, in their habitual bite, which will give the patient the ability to know where to put their bite the next morning.